Hello and welcome to vlog number 67. This week I'm going to talk about the benefits of forced exercise for people with Parkinson's. I have read a great deal over the last few years about the benefits of exercise for Parkinson's disease and have attempted with limited success to increase the amount of exercise that I do. The problem in my case, and I suspect with many other people that suffer with PD, is that I have very little energy and tire very easily. I was therefore interested to hear about forced exercise and the positive effect it has upon the symptoms of Parkinson's. I asked my Parkinson's nurse about forced exercise and she was not aware of it, although she did tell me that the physiotherapy department had got some powered cycling equipment and so she referred me for some physiotherapy. I met with the physiotherapist this week and she was similarly unaware of the concept of forced exercise and unsure of the suitability of their equipment for forced exercise. I was very surprised that two healthcare professionals who deal with people with Parkinson's on a daily basis didn't know about this treatment and its benefits. So, what exactly is forced exercise and what are the benefits to someone with PD? Forced exercise is a mode of aerobic exercise in which the rate of exercise is mechanically assisted so that the participant is able to achieve and maintain a rate of exercise that exceeds what they would normally be capable of without that mechanical assistance. It is important to note that the participant is not exercising passively but is actively contributing to the exercise. Forced exercise has resulted in neuroprotective effects and motor function improvements in animal studies. A research study using forced exercise has been undertaken by Dr. J. Alberts, a biomedical engineer at Cleveland Clinic. Dr. Alberts pedalled a tandem bicycle with the woman who had Parkinson's. The woman's usual pedalling speed was between 50 and 60 revolutions per minute, but she was forced to pedal at 80 to 90 revolutions per minute because that was the pace set by the doctor. Prior to the ride, the woman had been suffering hand tremors, but as the ride progressed she noticed that her tremor went away while they were cycling. Encouraged by this, Dr. Alberts undertook another forced exercise experiment with another Parkinson's patient who had had deep brain stimulation. The doctor and his patient cycled for 50 miles with the patient's DBS switched off. The patient was symptom-free during the bike ride. An 8-week proof-of-concept study involved 10 Parkinson's patients who were required to take part in 1-hour sessions on static tandems 3 times a week. Half of the group exercised voluntarily, the other half were forced to exercise at 80 to 90 revolutions per minute. The Parkinson's patients in the forced exercise group averaged an improvement in their symptoms of 30% compared to those in the voluntary exercise group. A fortnight after the experiment had ended, those in the forced exercise group maintained about a 20% improvement. Following on from this proof of concept, the doctor undertook a clinical study involving more than 150 participants and using TheraCycle motorised exercise bicycles. Data from this study has shown that forced exercise reduces motor symptoms in patients with PD. Magnetic resonance imaging, or MRI, has been used in another study, again involving Dr. Alberts, to show that forced exercise produces similar changes in brain activation patterns to Parkinson's medication, suggesting that medication and forced exercise use the same pathways to relieve the symptoms of PD. The study concludes that medication and forced exercise are two very different therapies which can improve symptoms in PD. This study suggests that despite their apparent differences, the changes these therapies induce in the brain connectivity are highly similar and thus they likely share underlying mechanisms. Well, I'll take exercise over medication any day of the week, so I'm keeping my fingers crossed that the powered cycles at the physiotherapy department are suitable for forced exercise, because I'm pretty sure that the cost of purchasing one of these for home use is going to be prohibitive. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.